Supply Cost by Aubrey Cox. Unity Healthcare. Unity Healthcare is an organization that works to promote healthy communities no matter the patient's ability to pay for health and human services. This organization focuses on having a culture that strives for great patient-centered care from an engaged staff, new technology, and strong partnerships and alliances. Unity Healthcare embraces the following qualities: listening, awareness, empathy, healing, respect, accountability, learning, and advocacy. Financial standing for Unity Healthcare. This slide shows the statement of financial position for years 2016 and years 2017. Financial standing for Unity Healthcare. This slide shows the statement of activities and changes in net assets for years 2016 and 2017. Financial standing for Unity Healthcare. Based on the financial statements from the year 2017 and the previous year 2016, the company can be considered in good and sound condition. The current ratio, which is current assets divided by current liabilities, is 9.74. This shows that the company is solvent and is able to pay its debt and payables. There is also an increase in total revenues of $3,979,276 from 2016 to 2017. In 2017, there's more revenues than expenses. And lastly, there's a decrease in expenses from 2016 to 2017 by $228,645. Components of healthcare finance system. The components of the healthcare finance system that provides funding for health include domestic sources and external sources. The domestic sources include businesses, which is 7% private insurance, and citizens, which includes 14% uninsured and paid for services out of pocket. The external sources include governments, which is 62% Medicaid and 9% Medicare, and agencies that are 8% DC Healthcare Alliance. Components of healthcare finance system. Grant and contract revenue contributed $43,789,211. Contributions and donations contributed $1,032,619. Funding support is provided from foundations including Clark Winchell Foundations and Stewart Trust Foundation. Contributors include businesses and individuals including Bencom Bennett Communications and Capital One. These components help provide care to 104,897 patients with a total of 504,966 visits at community health centers, medical sites at homeless shelters, and school-based health centers. Components of healthcare finance system continued. The funding, contributions, and insurance helps provide good patient care through patient and staff advocacy, new technology, and increased accessibility to healthcare to a range of patients, including those that are uninsured or homeless. The accessibility through the availability of staff and locations and changes in insurance coverage provides more patients with the ability to seek healthcare from Unity Healthcare. Short-run cost of production. Short-run costs occur throughout the production process and are affected by cost including variable and revenues. The short-run costs are not affected by fixed cost. As output changes and the rate of the production changes, so does variable cost. Variable costs include employee wages and costs of raw materials. Long-run cost of production. The long-run cost of production are those that impact the cost by the change of production quantity, change in size of the organization, or if they enter or leave a market. The long-run costs change as production levels change in response to the economy in order to produce the desired quantity at the lowest cost. Short and long-run cost. Long-run costs and goals are affected by how well the short-run costs are managed. The organization can take the time to plan long-run costs for the future to increase efficiency and reduce cost. This can include expanding different types of health and human services, increasing the number of facilities available to provide care, or entering another market to help improve the health of communities and individuals. Supply curve. This slide shows a graphical representation of a supply curve. Supply curve. Factors that affect the supply curve. If another organization that offers healthcare enters the market, then the supply curve will shift to the right as more healthcare services are provided if the price is expected to remain the same. Also, if the price of the health and human services increase, then the curve will shift to the left. And if new cost-saving or cost-increasing technology-based innovations increase the amount of services produced, then the supply curve will shift to the right. Financial plan to support viability. The use of long-run cost planning to alter short-run costs to increase efficiency and reduce the costs and expenses can be done through changes in staffing, use of new technology, and adding or reducing facilities. Also, increasing revenue can be done through expansion, including more types of services, more locations, and increasing staff to increase the ability to meet different patient needs regarding time, location, and service.